Good afternoon and welcome yet again to News Talk at Potchefstroom Herald. Today we're going to do a video interview with Dr. Tenza here because it is World Health Patient Safety Day, and Dr. Tenza has come in today. She has partnered with us though, and she has come in today to provide more information about what she's doing and what today is all about. Also, a great note about Dr. Tenza: she will be featuring tonight on ENCA on channel 403 on the DSTV around 9:15 tonight. So welcome, Dr. Tenza, and thank you so much for being here today with us at News Talk. We will sort of just dive right into it. Is that fine with you?
Thank you, Jade, for having me. I'm very excited.
It's a pleasure, Dr. Tenza.
Thank you.
Okay, could you please introduce yourself to our followers and tell us about your background and current role you are in?
Okay, so I'm Dr. Tenza. I'm based at the Northwest University School of Nursing at the unique entity. So my research, I'm a researcher and I'm also a senior lecturer there, and my research focus is really on patient safety, quality in healthcare, and my background, I've done a PhD on health system and policy from Wits University, and that sparkled more of my passion. And before then, I worked in both public and private sector. So that gave me a good background on understanding the South African health system. So on that note, I've been working a lot with quality and safety, doing publications on the same, and supervising PhD students and master students who are doing projects on quality and safety. And I've been speaking about patient safety and quality from in South African perspective, in locally and at community level and at international level. My bags are packed. I'm going to Turkey on Friday, and I will be speaking again in an international conference in patient safety and quality in healthcare in Istanbul.
Oh, that's interesting. Thank you, Doctor. What inspired you to focus on patient safety in your career?
Very interesting question, Jade. So I grew up in rural areas, and like real, very rural areas that when you must go to the shops, you really must budget the whole day, even to go and buy grocery. So the healthcare facilities were quite very far, and that made me to have that burning passion for provision of access to healthcare. So on that note of wanting, of having that heart that cries for access to healthcare, I wanted, when I get that access, it must really be quality and it must be a safe healthcare. So that's what drove me. From a young child, I always wanted to make a difference in people's lives, and more so in the aspects of health.
Okay, nice, Doctor. Can you explain the significance of World Patient Safety Day and why it is important for the global healthcare community?
So the World Patient Safety Day, it started being commemorated or observed in 2019, and it is an initiative by the World Health Organization to get everybody on board, not just healthcare providers, but an ordinary person who's walking on the street. We want to reach out to everybody to know that patient safety is everybody's business. And with the initiative of having this particular day of the 17th of September, we actually look globally, everybody, like every country. There are initiatives that are set to conscientize clinicians, healthcare leaders, healthcare policymakers, civil society, everybody who's involved in health, to think about patient safety, not only on this day, but to actively create awareness and make it very easy and acceptable to talk about the difficult conversations around patient safety and quality.
Okay, and it's while I was listening to you now, it is actually a very important thing though, because then patients can feel safe in that health environment.
Yes.
Yeah. So, what are some of the key challenges in ensuring patient safety that you have observed in your field?
So the patient safety is the challenges around patient safety. They are at multi-levels. They can't just be in one place, because if you want to deal with patient safety, there are many people involved in patient safety. There are patient levels, contribution from the patient, there are contributing factors from a healthcare provider level, and there are contributing factors at health system level. So challenges then, they can emanate from all these levels that I've mentioned. So for example, at patient level, you can find challenges that when a patient, anybody coming to consult, may decide, maybe the person consulted last week in a different facility and doesn't want to mention that he went to that particular facility. And when it comes to facility B now, and he doesn't mention he's already taking medicine from a different facility, then that can pose a risk, because now if he mentions he's got a headache and he doesn't say he has been treated already, then this person will take it as a first start and will give medicine, and that patient, if he continues with all the medicine, these ones that he's getting now, and the medicine he got before, so what does that mean? It means that's going to be medicine overload, and that's very unsafe for that person at patient level. And then at healthcare provider level, there could be issues like communication. If a healthcare provider doesn't communicate with the next healthcare provider, and that could delay decision making, and the person may not be able to, the next person who treats may also not be informed of what's already been done. And at health system level, healthcare providers, they come to work in systems that are already in place. They come to the facility that's already in place. They have much more control of resources that they are using. They can't do much about infrastructural issues and all those things that could pose unsafety into the patient. So hence I'm saying the challenges, they are all at different levels, and they require teamwork for us to combat those challenges.
Okay, and in your opinion, what role do patients themselves play in promoting their own safety within the healthcare system?
My favorite one is really honesty and being able to trust your healthcare provider, that you can say everything when you are consulting. And I mean, if you come to me and say you have a problem with a headache, meanwhile the problem is on your feet, then the medicine will concentrate on your head, and then it will not attend to your feet where the problem is, and that's going to pose risk for you to continue having the same problem. So the level of honesty, and I teach patients how to ask relevant questions so that they can be able to be active contributors in decision making when they are consulting with their healthcare providers. And there are simple things like getting to know your facility and getting to know what time facility open and what services that are provided in each facility or in your nearest facility, because sometimes it may not be you who needs the services. You may have a friend who needs the services. So when you know what services are there, you are already one way ahead towards safety, your own safety or the safety of your relatives.
That's actually good though. Great amount of information. Can you highlight any recent advancements or initiatives that have significantly improved patient safety?
So Jade, now we live in the times of technology, and it is very exciting. One of the things that I always commend COVID for having brought about is the fast tracking of things through technology because we were locked up, so we could devise means to still engage. So the issue of being able to have technology, and like for example, recently I've been engaged in conducting webinars in Africa region, and in those webinars talking to patients about healthcare safety and quality, and talking to communities, and that it wouldn't be possible without the initiatives of having now access to technology. So I really commend technology to.
So actually, you are saying that technology is actually helping
it's helping me to spread the word.
Oh,
it's helping me to spread the word. It's
Oh.
helping me because there is such a gap, Jade, between the communities and the healthcare providers.
Yes.
And it all started way back where a doctor was seen like a superior person from the patient, and it continued, but that is not the desired level of engagement that we want if we want to have safe healthcare. We want a level where patients can be in partnership with the healthcare system or the healthcare provider. But you can't be in partnership when you are not, when your knowledge is not elevated up to a certain level. So the empowerment to the communities, it's then enabling their voice to be able to speak up and know and not fear whether they will speak something correct or incorrect when they are engaged.
Do you say that because of this, the technology and the advancement of this, do you say that healthcare professionals actually now can engage with the patients in the safety about the patients? Do you say that patients now don't see the healthcare professionals as superior of them, or what is the level between them?
That's a good question. So we are moving towards that. The technology is an enabler to bridge the gap, that we can make knowledge available. So that is where the technology comes in. But I wouldn't say to you we have arrived where we want to get to on patient empowerment or on making the patients to be at a par, at partners in healthcare. We really, countries across the globe are striving towards that.
And regarding that also, are there any common misconceptions about safety and the engagement between the healthcare professionals and the patient itself?
Yes, Jade, there are misconceptions, and one that I would like to pick on is the very one, the misconception that maybe a medical person is miss or Mr. Know-it-all. If I can call it like that, then the minute you call me doctor, now it's like I'm knowing everything. Then that is a huge misconception, because you would know what you've put effort to know. Knowledge just doesn't come at a silver platter all the time. And I mean, with that also, it put pressure on medical personnel also to feel like they have to present themselves as knowing it all. And then if, say for example, any unsafety act has happened, then it's more likely to break down the person who's been raised up to believe that he must be presented knowing it all. So what happened to your knowing it all now, when things, it's kind of, we've removed the human part of being a healthcare provider, that as much as you're a healthcare provider, but you're a human being, to err is human. So everybody make errors. So if we make errors, even while we are driving or wherever, as a human being, so we kind of, there's a misconception of removing the ability to make mistakes if you are a healthcare provider. And that makes it very difficult then, even for healthcare providers to come out if they face situations where they make errors, or also it also make it difficult then to have open conversations around safety, because then who's gonna say he's making an error? Because we've socialized everybody to think that they must be perfect. Meanwhile, everybody is a human being.
And speaking of what you just said now, I believe that the doctor must create a platform, the healthcare professional must create a
Yes.
platform where the patient can actually feel that the patient belongs
Yes.
and can tell their story, not their
Yes.
health part, but their
Their
story
story,
to the
yes.
doctor, so that the
Yes.
doctor can understand
Yes.
actually the patient, if that is correct.
Yes, I agree with you.
Okay.
I agree with you. That is why I always say the patient is mastering the information. The patient is the one who knows. I mean, if you give a doctor or any medical healthcare provider, for that matter, a half story and you are not talking about everything, then that person will give solution based on what you've provided. So hence, it's very important then to create that environment where the partnership takes place. The patient brings the information, the medical person also bring the information that makes this person understand things better.
Yeah.
And then when you understand things better, then that's where informed decision making take place. Because then the medical personnel would be able to say, these are other options that we can deal with and this. Which one do you prefer?
Okay.
And then you come up, you devise the solution together if there are options.
Okay, nice. But we have to end this interview now. Finally, what message would you like to share with the public and based on World Patient Safety Day to encourage a culture of safety in healthcare?
I would just want to say to the public out there, hey, everyone, it's the World Patient Safety Day, and on this day, I really want you to sit back and reflect on how much would you like to know when you get to the facility, and how much would you like your facility to serve you better. And when you get to the facility, if you have any nearest facility, you can just visit it just to drop such suggestion in a suggestion box and go back. And I mean, the healthcare system requires the suggestions from the communities, and if you can write down things that you would like to see in the nearest facility, and that would really benefit the healthcare facilities a lot.
Yeah, and the more you talk to your healthcare professional, the more your healthcare professional will understand your problem you are in. So healthcare patient safety is actually very, very, very important.
Yes, it's very important. And you know, the more you bring out, we need to co-design the health system that we want to see. I often say that every one of us is a potential healthcare user, one way or the other, at any stage of your life. And we have to build the kind of healthcare system that we want to use whenever we need to use it.
Thank you so much, Dr. Tenza. I think our public really will find the insights and the importance of today's information you have shared with them. This is again News Talk at Potchefstroom Herald. I'm your host, Jade Sateria, and yet again, thank you to Dr. Tenza.
Thank you so much, Jade. I really want to thank Potchefstroom Herald for the engagements that we have together, working towards making you smarter and wiser on the issues of healthcare and safety. Thank you.
Thank you.